As part of our capstone project, Northeastern University has partnered with Off the Rock Media from Aberdeen, Scotland, in order to research and discuss social media and its effect on public health and governance discourse in Central Asia. In the countries we chose to study were Kazakhstan and Afghanistan. Our team consisted of 4 people to study Kazakhstan and Afghanistan as Central Asian nations. In order to accomplish our research, the team decided to divide and conquer, splitting it up such that one person would research social media and public health in Afghanistan, another would research social media and public health in Kazakhstan, one would research social media and governance in Afghanistan, and another would research social media and governance in Kazakhstan. We had 2 team meetings, but most research was completed individually. Each person was responsible for summarizing their research into 1 or 2 pages that could be read for the video, while photos and other videos were being shown on the screen. Summary of each deliverable and findings will be detailed in the video to follow. As a former Soviet country that maintains close relations with Russia, Kazakhstan is essential to study. Its geopolitical location between Russia and China, and acting as a link from China into Western Europe, will give this country a lot of influence in the future. As Russia's global influence has taken a hit in the wake of the Ukraine war, Kazakhstan had started to distance itself from Russia. Kazakhstan is a large part of what makes up modern-day Eurasianism. After the fall of the Soviet Union, the former Soviet states were left without an identity that was neither European nor Asian, thus the idea of Eurasian was born. The former Silk Road ran through what is now modern-day Central Asia, including southern Kazakhstan. As a result, culture was carried from China, through Central Asia, and into Europe. The countries that make up Eurasia happen to be almost an exact boundary of the countries conquered by Genghis Khan. The historical memory influences much of everyday lives and influences the development of politics and culture. Under the Mongol Empire, people lived for 3 centuries under the ideas of a loose, classless social structure and no private property. A different social order evolved in the areas controlled by the Mongols, and it's then perhaps no surprise that a historical map of 1920s Soviet Union almost perfectly replicates these geographic borders. In present times, we see a power struggle over Kazakhstan between Russia and China. When Putin came to power, he wanted legitimacy and created the Eurasian Economic Union, and Russia gave itself the ability to block unwanted decisions, thus maintaining influence over this bloc. China is known for developing its Belt and Road Initiative and leveraging its railroads from China through Kazakhstan and onto Europe. This is often referred to as the New Silk Road. Although Kazakhstan has blocked internet to citizens during times of unrest and protest, citizens still utilize social media platforms as a place to gather. During January 2022, protesters took to social media and the streets to protest what they believed was a corrupt election. During this nationwide anti-government protest, the government shut off internet for 1 week to this post-Soviet country, which speaks to the power of the internet as a place for people to gather. In November 2019, a Kazakh activist was sentenced to 15 days in jail for staging what he called a protest against Chinese expansion. There are many instances of these arrests. Despite laws punishing citizen journalists, Kazakh citizens have turned to social media as a form of information dissemination and protest. Politically, TikTok and Instagram were leveraged to urge people in Kazakhstan to go to the polls and build a new Kazakhstan rather than leave the country. In 2019, Nursultan Nazarbayev resigned as president of Kazakhstan after almost 3 decades, leaving much uncertainty. Influencers stepped up to urge people to vote and consider the future of their country.
Я проснулся в стране, где названия столицы меняют за один день, не спросив граждан.
Я проснулась в стране, где нет свободы слова.
Я проснулся в стране, где блокируют интернет.
Я проснулся в стране, где нет справедливого суда.
Я проснулась в стране, где в 30 лет я не могу позволить купить себе квартиру.
Я проснулся в стране, где почти в каждом городе экологическая катастрофа.
Я проснулась в стране, где запрещены мирные митинги.
Я проснулся в стране, которую покидают светлые умы.
Я проснулась в стране, где никто не верит в выборы.
With social media becoming the best way to connect with young Kazakhs, the country's institutions are following suit. Most of the ministries and government departments have an active presence on Twitter and Facebook as a way to connect with the voters. Besides politics, Kazakh citizens have used social media to teach others in the world about their culture. With more followers than Los Angeles-based Hype House, Kazakh-based YOLO House is the most popular TikTok house in the world. With YouTube being a popular platform in Kazakhstan, one young activist used social media, mainly YouTube, to bring awareness to the lack of clean water in areas of Kazakhstan. She brought clean water to 20,000 people in eastern Kazakhstan after her campaign. Although Freedom House considers Kazakhstan not free in terms of internet access, citizens and NGOs have been able to utilize social media platforms to share information. Besides mental health, the Kazakh citizens, government, and NGOs leverage social media to disseminate information about other public health concerns. In 2020, the COVID-19 shutdowns impacted existing public health programs worldwide, including in Kazakhstan. Kazakhstan has one of the highest incidences of tuberculosis, including multi-drug-resistant TB. Despite COVID lockdowns, doctors transitioned to virtual and outdoor treatment options. They also used this as an opportunity to increase awareness surrounding TB. 7 video spots were posted on Facebook and Instagram pages. These videos were viewed 600,000 times in the matter of 3 weeks by people from all regions of Kazakhstan. Many people also left positive and supportive comments. This campaign enabled USAID to not only raise awareness of the stigma associated with tuberculosis in Kazakh society, but also to demonstrate that large-scale social media campaigns could be successfully conducted during a pandemic. The COVID-19 pandemic also increased the usage of social media for people to remain connected and also to receive accurate information about the pandemic. UNICEF also leveraged the existing youth population of Kazakhstan to use their own social media channels to disseminate information about the pandemic.
Я Жаркунбаева Халамкас, волонтер ЮНИСЕФ, мне 16 лет, и я живу в Восточно-Казахстанской области, Тарбагатайский район, село Аксуат. В свободное от школы время я пеку выпечку. Негативные последствия карантина на молодежи – это нехватка общения. Из-за нехватки общения они впадают в депрессию. Думаю, из-за депрессии некоторые это может закончиться не очень хорошо. Пайдасыбар карантин – это был проект во время карантина, что полезно потратить время, фотографировать, снимать видео. Я узнала об этом в Инстаграме, когда выходили публикации про карантин, про COVID-19 и как с ним бороться.
When COVID-19 struck Kazakhstan, it was incredibly important for us to get information out to children and to parents as to how to keep themselves safe. And that's why we launched our online volunteering program, involving about 1,500 volunteers who delivered online lessons and also used their own social media channels to spread information and also to fight misinformation about the virus. These young volunteers that worked with us had an incredible reach. They had a very high level of engagement, particularly through their own social media channels.
Название «Пайдасыбар карантин» говорит за себя. Хотела все больше притягивать людей в этот проект, учила, как фотографировать, делилась советами. То, что получила полезную информацию, тоже делилась. Это был первый опыт волонтерства в моей жизни. Мне это было интересно, и меня родители поддержали. Мы придумали эстафеты. Папа каждый раз покупает нам обруч, мячики и так далее. Мы выстроили все это в ряд и придумали эстафеты. Каждый день кто-то должен был придумать что-то новое. Так мы провели свой карантин с пользой. Мы часть снимали на видео, отправляли родственникам, говорили, чтобы они тоже занимались этим. Мы вообще удивились, когда среди 1000 участников что-то выиграли и кто-то оценил наш труд. Я хочу заниматься дальше волонтерством, помочь тем, кто нуждается в этом, чувствовать то, что ты сделал добро и делаешь этот мир лучше.
NGOs based in Kazakhstan have found success with peer-to-peer counseling, particularly with stigmatized conditions like HIV and AIDS, since Kazakhstan has the highest incidence of HIV in Central Asia. UNESCO and Kazakh citizens, media partners, celebrities, and bloggers have also implemented an online campaign, #NoOneShouldBeLeftBehind, to raise awareness about HIV and discrimination. The campaign reached 1 million people with the goal to dispel myths and stereotypes about how the disease is spread and provide correct information. Findings indicate that this campaign was a success in helping decrease stigma. Unfortunately, in May of 2022, the Kazakh government signed a law allowing the government to remove or restrict social media content under the guise of protecting people. In extreme cases, like during the election protests in January of 2022, the government has blocked the internet and social media platforms entirely. The Reuters Institute Fellows paper by Bahar Joya examines the challenges Afghan women have experienced over the years in securing their fundamental human rights. Joya speaks about how social media is changing Afghan social taboos and how it is affecting the lives of a group of people who have been left out of society. The findings regarding how social media affects women come from interviews with women who live in urban areas across different Afghan provinces. Few homes had access to any form of communication prior to 2001, but by 2016, the Ministry of Communications estimated that more than 18 million people, or more than 50% of the 32 million, were using mobile phones. Less people have access to the internet. Since 2006, more girls and women have been given permission to enroll in college. Even though very few families had access to the internet at home, this gave them the opportunity to learn about computers and the internet. From this small beginning, a few women, usually living in cities, were able to connect with the outside world. The majority, though, acted covertly. On social networking platforms like Facebook, the majority created secret identities by utilizing bogus names and images. The use of social media was still in its infancy at the time this article was written, but a 2016 survey by Hootsuite and We Are Social found that it had grown by 43% between 2015 and 2016, and that nearly 10% of individuals, or 2.7 million, use at least one social media platform. It is impossible to determine the precise number of female users because the majority of women do not use their own identities on social media profiles. According to data from the Ministry of Communications, 20% of those who have access to the internet are women. In conclusion, Joya's interviews revealed that 1 in 10 of the women interviewed said that they were willing to use their own pictures on their Facebook, Viber, and WhatsApp profiles. However, all of these women said that they suffered abuse as a result of their openness, and some have been forced to change their behavior online. Of the 10 women in the study who reveal their identity, like through real names or photographs, on social media, all reported some level of violence and recrimination, both online and also in public, because of their social media use. 1 in 5, or 20%, of 100 female Facebook users who participated in the study said that they used their real names but not real pictures on social media. Nearly 3/4, or 70%, of female respondents chose to remain totally anonymous by using a fake name and fake picture. Most, or 80% of the 70% who remain anonymous, said they choose not to reveal their identity on social media because of the risk of recrimination. Only 10% of women interviewed for this study said they used Facebook or any other social media to challenge the country's social taboos. Of the 20 men interviewed for this paper, nearly all, or 75%, said they did not agree that women should have total freedoms on social media. Only 30% of interviewees, who were mostly educated professional men based either in Afghanistan or abroad, said they would allow female family members to reveal their identities on social media. In Afghanistan, citizens are active on many social media platforms. The threats to female journalists are real in part because the success and visibility of female journalists have angered those who are so threatened by it. Afghan news sites or social-only sites like Afghanistan My Passion compete for space on digital platforms awash with quality content. Today, around 70% of all Afghans have a mobile phone. 48% of women have access to a mobile. Facebook and Messenger are by far the most popular accounts in Afghanistan, with over 4 million users. Other platforms, Twitter, Instagram, and TikTok, are breaking through. Many popular Afghan accounts are run by the diaspora from Dubai, Europe, and America. 80% of Afghanistan social media users are between 18 and 34. Afghan citizens have been successful in using social media for social good. Afghan women are using a social media campaign to fight back against a strict new dress code for female students amid fears that the Taliban-led government will return to the strict interpretations of Islamic law that it employed during the militants' first time in power in the 1990s. Many Afghans were taken aback when the Taliban imposed a strict new dress code for women students, prompting women to share pictures of themselves wearing colorful traditional dresses, using hashtags such as "Do Not Touch My Clothes" and hashtag Afghanistan culture. This has also had an impact on journalism. On September 19, 2022, journalism rules were introduced, and these rules that Afghan journalists will now have to implement are vaguely worded, dangerous, and liable to be used to persecute them. The first 3 rules, which forbid journalists to broadcast or publish stories that are, quote, contrary to Islam, insult national figures, or violate privacy, are loosely based on Afghanistan's existing national media law, which also incorporated a requirement to comply with international norms, including Article 19 of the Universal Declaration of Human Rights and the International Covenant on Civil and Political Rights. Rules 7 and 8 facilitate a return to news control or even prior censorship, which has not existed in Afghanistan for the past 20 years. The 9th rule requires media outlets to, quote, adhere to the principle of neutrality in what they disseminate and, quote, only publish the truth. Could be open to a wide range of interpretations and further exposes journalists to arbitrary reprisals. Since the Taliban has returned to power in 2021, women have lost 20 years' worth of women's rights accomplishments and activism, including the right to an education and access to family planning classes, reproductive health screenings, and checkups. Women's rights organizations like the Women for Afghan Women organization were once incredible tools but have been forced to shut down when the prior government fell in 2021. The organization was operating 34 protection centers where family guidance was offered, yet the company now cannot share their work or their center locations online for security risks. Afghan women are not receiving the information necessary to keep them healthy and safe through government-funded institutions or endorsements, and they are not allowed to receive this information from non-government agencies. This is where social media has come in to promote and provide access to online classes and access to important health information. In 2021, the prior government planned to implement the Integrated Package of Essential Health Services, which offered women counseling, contraception, safe abortion care, STIs, RTIs, HIV, gynecology, prenatal care, and gender-based violence. When the Taliban took over the country, this program was never implemented, leaving women uninformed and in danger. Afghanistan has both a high birth rate and a high infant mortality rate, and with a lack of tools, these numbers will only grow. There is no telling when there will be government-inflicted change on this because the Taliban does not see the issue in the lack of education and resources for women. Digital health programming has created safer environments for women's knowledge of fertility and contraceptives in India and Kenya, and this can now be replicated in Afghanistan. Scholars have conducted a study that tests the effectiveness of using cell phones and the media to share information with women in Afghanistan that pertains to their reproductive health knowledge. The majority of Afghan women own their own cell phone or have access to a friend or family member's phone. The Afghan Ministry of Public Health and the USAID-funded Hemyat helped to create a program where callers were able to dial 234 in order to hear the necessary information that they need to know about their health and their infant's health. Facebook and Instagram posts were also used as promotional methods for the information provided and the calling program. This program and the promotional methods used proved to be very successful in informing young women of their resources and shows the importance of using social media platforms to reach the target audience. This method is better than in-person outreach because it is able to spread across a larger number of women, especially now with Taliban restrictions and women's inability to travel without being accompanied by a man. As the Taliban took over in August of 2021, the mental health of all Afghan citizens became a concern because the progression of 20 years had been erased. A survey was sent out via Twitter, Facebook, LinkedIn, and WhatsApp groups by Frontiers in Public Health that questioned people on their concerns of U.S. troop removal and the Taliban takeover. Considering the small amount of time between these two major political events, this survey covers the reaction to both. 54% of females reported extreme concern in terms of mental health. Without the presence of these types of surveys, NGOs and other humanitarian groups would not be able to assess the issues that are going on in the country. They are shared and displayed on social media, which gives several different demographics the ability to tell the world what they are feeling and even give people the sense that they are not alone. Some concluding thoughts include potential areas for further study, including Kazakhstan's relationship with China and the government's willingness to shut down the internet to prevent discourse. Short-form videos educating people about democracy are a potential way for a social media company to tap into this country. In Afghanistan, the Taliban's laws are becoming more and more restrictive, but we do see that people have access to phones and social media. Increasing access to phones with internet can help people obtain access to educational information, either through short-form videos or written content in the case that the information needs to be accessed quietly.